Bismillahirrahmanirrahim. Today my topic of presentation is healthcare project management, critical path method and PERT. Life is not about having everything, it is about finding meaning in everything. Learning objectives of today's presentation is project management introduction, project management objective, critical path method, PERT, challenges of healthcare project management, conclusion, recent advances and MCQs. Learning outcome. By the end of this presentation, participant will be able to describe the project management critical path method PERT, challenges of healthcare project management. Now, what is the project? A project is problem scheduled for solution. This definition forces us to recognize as project a defined solving problem and the failures to define the problem. Now, what is a problem? A problem is a desired objective is not a problem by itself. The key to problem is that there is obstacle that prevent us from closing the gap. A problem is a gap between where you are and where you want to be, with an obstacle that prevent easy movement to close the gap. Problem solving consists of finding ways of overcoming or getting around obstacles. Now, what is project management? It is planning, scheduling, controlling of project activities to meet the project objectives. The major objective that must include performance, cost, time, goals, while at the same time you control or maintain the scope of the project at the correct level. Now, what is the scope of project? The scope of project should maintain constant throughout the life of job. Unforeseen problem or an inadequately defined problem is most common reason for scope change. That is something forgotten. The scope of project is generally increases. The only time project scope decreases is when the budget is cut and some originally planned work is put on hold. The problem with scope changes is that they tend to be small and incremental. If a number of them occur, the project budget or schedule may offer. This is fairly common cause of project failure. Now, project manager and the scope. A project manager has responsibility to keep this stakeholder informed about the impact of scope changes on the project, protecting them from surprises at the end of the job, and protecting the project manager from being evaluated on additional target rather than one revised. Therefore, the four objectives of project management include performance, scope, cost, and time. The performance include the quality of the work being done, scope include magnitude of the work being done, and cost of the time include directly related to human and physical resources applied, and the time include the schedule that must be met. Now, overview of the some pathways, critical path method which is used in project management. It is one of the method which is used is project management tool. It is one type network diagram that shows the different activities, step by step algorithm, methodology, and technique for planning the project. Technically, it is the longest path of network. It is the largest and there's least amount of float. In project management, float is defined as the amount of time that a task can be delayed without affecting delay to subsequent task and project completion task. In critical path method, activities are shown in network diagram as a network of precedence relationships using activity on a node framework. PERT is another project evaluation technique which or use project management tool that shows a graphical presentation of different activities in timeline. The program evaluation review technique breaks down the whole activities into individual tasks for analysis. Most commonly, PERT charts considered to be Gantt bar chart because they are idly identifiable task dependencies, but they are often more difficult to interpret the activities and event. It helps project manager to analyze various tasks and estimate the amount of time required to complete the task. Using this subjective information, project manager can easily calculate the minimum amount of time required to complete the whole activity. Now, difference between PERT and CPM. PERT is full-time project evaluation review technique, whereas CPM is critical path method. PERT is event-oriented, it is activity-oriented CPM. PERT manages unpredictable activities, whereas CPM manages the predictable activities. It is focused on time control, PERT, where CPM is cost optimization. It was developed in 1958 PERT, and CPM is developed in 1957. PERT is three-time estimate, whereas CPM is single-time estimate. PERT follows a probability model, whereas CPM follows deterministic model. Assalamu alaikum, madam. मैडम मैंने स्टार्ट कर दिया, रिकॉर्डिंग मैंने दोबारा से स्टार्ट की है। जी वही वाला मैडम, वही वाला। मैडम मैंने डिसेबल कर दिया होगा। ओके प्लीज। Now, advantages of CPM. CPM, the critical path method analysis indicate the activities that run parallel to each other. It is easily found at most critical elements of the project. CPM gives a practical based visualization that helps in determining how to reach the aim of project within the time limit. CPM is effective in project management. It can strengthen the team perception if it is applied properly. It provides a demonstration. It shows the various project activities and their outcome as a network diagram. CPM gives a fair and parallel procedure document, a clear-cut approach to communicating project plan, schedules, and time. It helps in time optimization by determining the project duration. Disadvantage of CPM is that it is difficult to estimate the completion time. The critical path is not always clear. When succeeding and preceding activities for larger project, critical path methods can be complicated too. It does not manage its scheduling in a critical path method. Critical path needs to be calculated very accurately because that affects the completion time of particular project. Advantages of PERT. PERT is project evaluation review technique. It is suitable for large types of project and also scheduling if different activities is done easily. Each coordinate manager has to plan the events for which he or she is responsible. It is the main focus on critical elements of the project. It makes forward-looking concept for the project manager. The main aim of project report and pressure for action that at the particular spot and particular organization at the particular time. Disadvantage of PERT. Another biggest disadvantage is that it gives time, but not on cost. It is more suitable for large and complex projects and not suitable for small and repetitive works. Also, time requirement to complete each activity is highly subjective, so the programmer evaluation review techniques high chance of incorrect critical path. Now, component of CPM and PERT network analysis. It has major two component, activity and event. Activity is actually the action or utilization resources in the form of money, time and material required to complete the project, whereas activity is represented by the arrow. In the network, two types of activities, proceeding and succeeding activities. Proceeding activities performed before a given event. Succeeding activities performed after an event. As in the figure A and B activities, we can see in this we can see that A activity, then it lead to C, then D and B, and it can follow the various pathway, and this represented by preceding and succeeding activities. For example, in this example of the CPM pathway, various pathways given for critical path, and we see that the critical path method of this include the largest path, which is longest pathway, A, D, then E, F and C and H. Then this is all critical pathway, and project completion time to this pathway should be 16. And as the network analysis, so because critical path method is also already described as the longest pathway in network analysis. Now the stages of project life cycle. It includes the initial stage, planning stage, execution stage, and closure stage. Planning phase include detailed planning, estimation, and scheduling. Then first initiation phase, which include project definition, constraint, and statement. Then planning phase, a detailed planning, estimation, and scheduling. Then execution phase, which include project team execution, development, and management. And then project closure, which include monitoring, controlling closure, and review. Initiation phase include the things to be undertaken, feasibility of the study. It includes purpose, vision, and mission of the project, high-level project description, summary, milestone of project, and assessing the scope of work, identifying the deliverables, identifying stakeholders of the project, comparing the potential costs and benefits of the project. In the planning phase, it is the most important phase. The better we plan, easier will be execution. In this phase, we need to task breakdown larger into smaller tasks. It includes two-part strategic planning, where we develop overall approach to the project, and implementation planning. So, in this, the goals are and objectives are set, which should be smart, include specific, measurable, achievable, realistic, and time bound. The things to complete during this task include project plan, resources in the form of money, manpower, material, budgeting, quality plan, which is the most important step in planning phase, risk plan, acceptance plan, communication plan, and procurement plan. Then come execution phase. Project execution is the phase where plan is now brought into action after the final approval and completion. This is a very intimating phase of project where we can see the actual work happening, and it includes monitoring the work goes side by side during execution. And steps for project evaluation include creating tasks and organizing, providing necessary guidance, regular communication, monitoring the quality of work, and managing budgets. And things during these include time management, cost management, quality management, change management, risk management, and issue management. And then come termination phase. This is closure phase, as the project is temporary and it has come to an end. By this time, all activities are carried out, and things to consider during this phase include analysis of project performance, analysis of team performance, documentation of project closure, conducting a final analysis of project, and closing the finances and budget aspect of the project. This is see the project life cycle, defining the objective and goals, and planning, executing, and delivering phase. Now, public health and project. Public health is concerned with assessment and monitoring of health of the communities and population at risk, formulation of public policy to solve identified problem, and setting of priorities. It works towards appropriate and cost-effective care. In the public health context, quality is a key matter as many projects are concerned with survival issues, and government is commonly a stakeholder, and public funding provides a central role in the public health project management. And there's a triple aim project that improving the healthcare system requires simultaneously three aims: improving experience of care, improving the health of population, and reducing per capita cost of healthcare. And therefore, what is different about healthcare project management, that there are two camps of staff: clinical patient-oriented enterprise viability and sustainability. Healthcare has unique terms. Projects have often separate paths that can divide it into phases: technical and clinical. And project management is not as a mature practice in healthcare, and there's little training, and decision making can be very slow. And the clinician view project success differently. And if we see through typical perspectives on the form of time, scope, and cost, and if we see through clinical perspective, it include efficient clinical workforce outcomes and patient safety. Therefore, how we can do in the past of project management, and what the clinician supposed to be, that I am here to treat the patient, not to do paperwork. This is the actual previous concept in the project management. And the project management now conceptual frameworks is also same for all projects. It includes stakeholder needs and expectation, process groups in initiating, planning, executing, knowledge areas, integration, scope, cost, quality, human resources, risk procurement, and tools and techniques, and project portfolios. Characteristics of project management cycle include consistency at all stages should be maintained, and consistency regarding standard flexibility. Project has to be consistent, but does not mean that project management cycle should be rigid. It should be flexible. It should be transparent, which is the most important feature of project. At all works, there should be stages. There should be transparency needed to be maintained. Goal achievement. Advantage of project management cycle. Through project management proper cycle, we can aim is to achieve the goal of object and whole PMC works to achieve. And also goals are smart, effective. We can effectively use the time and resources, and optimum utilization of resources. There, all the staff come together in planning and brainstorming, therefore, which can foster ideas, and there should be better communication. We can also, one of the major feature is that PMC through project management cycle, there should be risk assessment, which is done at the planning phase, and risk when assessed earlier state prepare help to tackle them. But disadvantage or limitation include high cost. It can be complex, make the project look more complex, rigidity in plan, and lack of creativity. Sometimes it can suppress the creativity. Deadline, stressful environment, predefined activities may not let the creativity of the staff to sprout out. Success of any project. During last 3 decades, success has been explored as central theme in project management. And the success is multidimensional concept in healthcare management. It should be subjective, objectivist or subjectivist paradigm. And regarding success, attempts towards harmonization are often seen as negative, as they sketch a generalist view of factors related to project management. Therefore, success of any healthcare project of public health project mainly depends on global impact on target population. Although this is not easy to measure, as a result are frequently not tangible. The difficulty in measuring effects present a considerable challenge for project and program manager. There are some sample project management outcome when there come The results are shown. Various stages we can see through pre-initiating and initiating phase. We can do SWOT analysis, mind map, balanced scorecard, business during planning card. We can use project management plan, scope statement, requirements, traceability metrics, project schedule, cost baseline, quality metrics, human resource plan, project dashboard, project impact matrix. During executing phase, you can use the output such as deliverables, milestone reports, change requests, project communication, issue logs. During monitoring and controlling, you can use earned value chart, acceptable deliverables, quality control charts, performance reports. And during closing, you can use the project completion form, final report, transient plan, and lesson learned report, contract close notice during project management output. There is some sample which is SWOT analysis which is done during the initial initiation phase. It is a sample SWOT analysis. This is business case executive summary. This is the mind map to help identify the project SWOT analysis. This is a project dashboard, which is actually project management output. There's Gantt chart, progress report. There can also cause and effect diagram, probability impact matrix, which can identify and prioritize risk. There is also earned value chart, which can assess progress in meeting goals, uh, which can estimate a budget at completion and budget at completion. Therefore, education can help public health and healthcare managers to work on right budgets, educate project managers, staff and clinical work and clinical staff get to work together and mark investment, IT infrastructure and quality improvement. Good project management is required, showing clinical leaders project management value is a must. Therefore, there are some challenges in achieving the goal. For example, in healthcare, there's a quality, real fact time, grouping clients, breaks, graduation, access to project, privacy, complexity, time frame, and little basis in project, in business, in project management, healthcare basic structure. Therefore, challenges include in healthcare is distinct and complex, and risks include funding and optimization, quality and efficacy. Therefore, one by one, funding and optimization, which, for example, project management aligns money with activity. To deliver the greatest benefit from available finance, the project must be optimized, which means allocating the right amount of space towards right theaters, diagnostic suites, and public areas. There may be quality and efficiency issue. The quality control is a major part of project management in healthcare. All opportunities should be considered for efficiency. Therefore, increased demand for healthcare combined with rising cost to deliver economical high quality services. Second challenges include the high discipline diversity in healthcare technology, and there is also the common language issue. For example, various disciplines are involved: surgery, physical therapy, social work, nursing. This is particularly difficult to address in healthcare team because of apparent simplicity of terminology, but apparently obvious question can be very useful until a common language is achieved within the team. Therefore, project manager should ensure that team member overcome their functional unfamiliarity. A lack of skilled resources and efficient change methodology, which is actually pressure to change rapidly, in especially palpable in healthcare, are the organizations historically changed during last 2 decades. Their change in communication, this result in lack of understanding, acceptance, and ultimately adoption of change, leading to failed project outcome. A number of issues can be affecting industry. Issues for which project management is actually vital include decreasing payments from governments, new and complicated system for electronic health records on patient, new technologies, new regulation continue to emerge. There is a greater scrutiny from outside groups, including government, health insurance companies, and patients, which include deficient health methodology, which is the biggest challenge in healthcare public health project management. Conclusion. Therefore, the healthcare industry is behind most other industry in terms of project program portfolio management. A project manager which are working with a project for the first time, it would be probably best to use the PERT analysis initially. After using the method, in getting more consistent commission time for activities, they at that point can become duration of those activities using then CPM. Therefore, their first approach should be PERT. If he is new in supervising the project. Therefore, there is a huge need to educate clinical staff in management the many healthcare related projects. We can improve the healthcare in this country through one person, one talk, one course, and one project at a time. Then come recent advances. There is a systematic review published on project management in public health recently in 2020. Background is that success is not a central concept in project management, and yet literature is relatively extensive and generally focusing towards the project management success. And this aim of the focus is protection of the health of specific target groups of population, and the result of the some systematically reviewed papers identify general project success criteria and success factors that describe the specific evidence for public health field. Therefore, it can describe the some success factor during project management in public health. It includes the triangle of virtue: client satisfaction, stakeholder satisfaction, efficiency, impact on business, opportunities for future growth, system technical strength, key performance indicators, and value creation. Success factors also include the mission, vision, and goals, top management, support planning, stakeholder management, community participation, time performance, monitoring and evaluation, communication, troubleshooting, project manager performance, resourcing, leadership, consumer involvement, project management, agile processes, benchmarking, and organizational structure. Some failure factors are also identified through this systematic will include project benefit, top management support, insufficient top management support, organizational culture include organization inertia and lack of cooperative incentive, change management, organization resistant to change, culture and values, there's a lack of honesty, leadership is intolerant to bad news, project complexity leads to high difficult to manage, planning there is unrealistic deadlines or expectation which are some identified to this factor, failure leads to project management. Another article published include public health and project management. Do projects deliver? Material, it is actually the maternal and child health has remained ever in the perspective of MNSHCH, which is remained an ever concerning area for hospital management and researchers throughout the world. There, in this literature, less attention is paid to developing countries. The current study identifies the problem faced by maternal, newborn, and child health project at every phase, and they can obtain data on maternal and child health projects by interviewing from district project manager and extracted various themes. The results show that the most significant problem faced by maternal and child health project emanate from inefficient bureaucratic structure, lack of holistic planning, weak work environment, political interference, inefficient knowledge acquisition. The current study found that the project manager experienced various problems from the initiation phase of project to its closure. Additionally, this study finds that there is poorly equipped to manage such problem. Therefore, they proposed that these studies such as strategies such as implementing a bottom-up management approach, more decentralization, establishing patient feedback system, give more authority to project management, and so forth. Now it is time for MCQs. MCQs 1. Project management is the application of process, methods, skills, knowledge, and experience to achieve specific project objective within the agreed upon parameters. The part in project management means program evaluation and dash technique, alpha resource, B reconciliation, C reconsideration, delta review, and E is restoration.
Delta.
Delta. The correct option
Delta.
is delta. Yes, as PERT is the project evaluation and review technique in project management. Therefore, the correct option is delta review technique. MCQs 2. A public health team wanted to initiate a research project on tuberculosis control program in the XYZ community. The project will be ongoing and will not have a deadline. Which network technique will be most appropriate in this scenario? Alpha cost effective analysis, beta cost benefit analysis, C cost utility analysis, delta PERT project evaluation and review techniques, E CPM critical path method.
E.
Delta.
E.
Correct option is delta, as I already mentioned in scenario that project will be ongoing and it will have no deadline. And in XYZ community, for example, therefore the project evaluation and review technique should be the correct option, whereas all other options are the economic evaluation technique. As assembling project team and assigning their responsibilities are done which phase of project management? Alpha initiation phase, beta planning phase, C execution phase, delta closure phase, or E pre-initiation phase?
C.
Alpha. As I've
Okay.
already mentioned during project management cycle that the project assembling project team and assigning the responsibility done before the planning phase, which is come at the initiation phase. Therefore, alpha will be the correct option. MCQs 4. In project management, a critical path is a larger sequence of activity that must be completed on time in order for entire project to be completed. Any delays in critical task will cause the rest of the project to be delayed. A critical path method therefore manages the dash activities in project management. Alpha preceding activities, delta predictable activities, C physical activities, delta succeeding activities, E unpredictable activities. What will be the correct option?
Alpha.
C.
No.
A.
As beta will be the correct option, predictable activities, as I already mentioned that the preceding or succeeding activities is already the component of critical path or analysis or PERT analysis. Only perform of during performance of critical path method, the predictable activities is mainly concerned, whereas in unpredictable activity is mainly in the PERT analysis. Therefore, beta will be the correct option. The critical path manages the predictable activities. For the first time in XYZ community, an XYZ health project manager is assisting an HIV or AIDS control program project. What is the most useful approach for new health project manager to complete the project at the start? Alpha cost effective analysis, beta cost benefit analysis, C cost utility analysis, delta PERT or ECPM. What will be the
E. E.
delta? As I already mentioned in one of my slides that if the project manager is new in any healthcare projects, he should consider first of all the project evaluation and review technique during their initial phase, and after he can gain consistency and knowledge, then he should adopt the CPM or critical path method. Therefore, delta will be the correct option in any healthcare program. First of all, he should, any new healthcare manager or project manager, he should consider the PERT analysis technique in any healthcare project. MCQ 6. A project manager is the charge of informing stakeholder about the effect of scope change on the project. The project's performance objective is associated with alpha completion of the work, beta cost of the project work, C quality of the work, delta quantity of the work, E time of the work. What will be the correct option? The performance objective.
C.
C will be the correct option as the project performance objective is actually associated with the quality of the work. Therefore, the C will be the correct option, quality of the work. MCQ 7. Figure 1 depicts a visual representation of activity on arrow network. The activity on arrow network is actually that networking diagram technique in which activities centered by arrows and connecting at nodes to show the sequence of events in ABC health project. What is the critical path for this small project in this case? Alpha 10 days, beta 15 days, C 20 days, delta 25 days, E 30 days. What will be the critical path for this small project? There's three pathways.
D.
Delta, okay,
25.
delta will be the correct option, 25 days. As when we see these pictures, I already mentioned that critical path is the largest pathway. Therefore, if we see that this is the pathway 1, 2, B, D, G, and I, this is the largest pathway, critical path. If we can add 5, 12, 4, or 4, then there should be 25 days for this small critical path. The critical path for this small project will be delta 25 days, which is actually the critical path. MCQs 8. The quality management planning process identifies the quality standard that apply to project and devices a strategy to meet them. Quality control comes under which phase of project management cycle? Alpha initiation phase, beta planning phase, C execution phase, delta closure phase, E pre-initiation phase.
C.
Beta. As I already mentioned that quality control is a very important concept in the project management cycle, and it comes in under the planning phase of the project management cycle. Therefore, one should consider the quality management, quality control always under the planning phase of project management cycle. Therefore, beta will be the correct option, whereas in initiation, execution, closure phase, there is not much role of the quality control. MCQs 9. An ABC Health project manager wanted to represent the output of specific health services for the XYZ community during the initiation phase. The following is an example output for project management during the initiation phase. Alpha project dashboard, beta project schedule, C quality metrics, delta scope statement, E SWOT analysis. What will be the correct option of MCQs 9?
E. D.
Yes, E will be the correct option as in this phase we can see I already mentioned in one of my scenario that various project management output tool used for the various picturization or depiction that during initiation phase most commonly used is SWOT analysis. Therefore, E is the correct option, whereas project dashboard, project scheduling, quality metrics, scope statement are various techniques are also various techniques during the project management. Um, Therefore, the E will be the correct option. 9 E will be the correct option. Use 10 critical discord between physician and administration XYZ city makes an ABC health project particularly difficult. There is lack of understanding, acceptance, and eventually adoption of the change, resulting in failed health project outcome. Project manager of the ABC health project face one of the following challenges of health project management in this scenario. Alpha deficient change methodology, beta funding and optimization, C high discipline diversity, delta lack of skilled resources, quality deficient. What should be the challenge?
C.
Alpha. As in my challenges slide of various most common challenges facing the healthcare project in public health is actually the deficient change methodology, which include there's a lack of understanding, acceptance, and adoption of any change, which can result in failed project outcome. Therefore, other issues not fitting in this model, for example, funding in this scenario, optimization, high discipline diversity, or lack of skilled resources, quality, and efficiency. Therefore, in this scenario, the deficient change methodology will be the alpha will be the highly most suitable challenges in this scenario. Therefore, alpha will be the correct option, deficient change methodology. This is the key of my MCQs. Thank you.